And Anna raised her hand really quickly, so I think she had a question.
So I have a question that kind of sort of ties together some of these talks together with some of the stuff we heard this morning. I think, so things are happening in cities all the time, right? So that things are changing. Sometimes intended changes, but on actual policy, or sometimes because things happen. And now we're starting to be able to have the data, other sources of data, to help us characterize those changes. So I think it's really a unique opportunity to think about natural experiments and how we can really capitalize on that variation that's happening so that we can really not only evaluate policies but also understand the real drivers of population health. And I think sometimes one of the challenges in observational studies, in addition to the many things, important things that Sam mentioned, is also that the things that we're studying are not the manipulable necessarily things that that we really need to intervene on, and also cross-city comparisons. So we could potentially learn a lot from that. So I'd like to hear from any of you, the more data people as well as the more analytical people, on where do you see some potential opportunities to really bring together this incredibly rich new data that we'll hear about more later today as well, with our analytical ability to look at this variation in a different way to learn something.
I'll just make a general comment. Someone might have a specific example they want to give. So natural studies are the bedrock of macroeconomics, and they, as you said, provide a lot of opportunity to other areas. So I think one of the advantages of this sort of the things I talked about, which is web data, social data, is that the data is there. And so you can start with very open-ended questions and explore the data to see what it supports and what's there. So for some of the studies we talked about, like the mental health stuff, we didn't start with really well-defined questions of what we wanted to answer. We just said, well, what is in the data? And we started searching through data that we had and discovered what people are talking about, and then from there developed hypotheses. So I often pitch these sorts of data sets as hypothesis generation opportunities, where when I talk to, for example, people doing telephone surveys, where every question is very carefully considered and evaluated whether or not they want to ask it, because every question's time and money. I say, well, start with this data set to figure out what are the interesting questions to ask, what are the likely answers you're going to get, and then you can decide if you want to then do a careful study of that question. So I think there is a lot of opportunities for discovering these kind of natural experiments in these data.
Yeah, I would just add, there was a comment earlier about just getting studies funded, and that's always a problem. A new policy is rolled out, and there's just not time to implement a study to really effectively measure the change. And so I'm on study sections where you see PIs proposing studies to kind of capture these natural experiments, but they're just not, they often don't get funded in time to capture the change. In the case of my study, California is likely to legalize marijuana in 2018 or 19. So we're hoping that we can extend our study, which would be a natural experiment, and then see what happens to this cohort, these patients and non-patients, once they're in a fully kind of legalized marijuana using environment. So I think if there's a chance to sort of existing studies that are funded when new policies happen, I think that's always a benefit.
So I agree completely with Anna's comment that, right, I think the 5 talks sort of congeal, so to speak, right? Their confluence is really the opportunity, and it makes things easier, get things done without necessarily having the funding in advance. You create the methodologies that create the opportunities. So to not want to be redundant, I guess I'm going to go a step further than I think we're ready as a field to go yet, but I think one of the opportunities that's out there is, as you suggested, this cross-city idea and going beyond the study and the assessment and evaluation of our major metropolises, right? We've studied Chicago to death. Chicago's been studied to death. New York, Los Angeles, Boston, we're catching up quickly, if not already there. Baltimore, these cities have been studied a lot, but then does anyone ask about White Plains, New York, right, or Yonkers, right? Worcester, Massachusetts, these smaller cities that don't get a lot of attention. And I guess I wonder, in this age of kind of increasing amounts of harvestable data, and then the ability to implement these sorts of natural experiment type methodologies, these sorts of research policy collaborations around interventions. Can we extend these methodologies across an entire metro region? Can we extend them across an entire state? And that's going to take a lot of work, right? There's major issues of data compatibility, right? Does a 911 call referencing a stroke or a heart attack or cardiac arrest in one city look the same in a database as it does in another city, right? Is it marked the same way? Is it referencing the same content? So these are all issues we're going to have to deal with of validity and such over the coming years. But I think the problems are solvable, and I think if we do solve them, we can start to answer questions much more broadly than what was previously the gold standard, which is neighborhood versus neighborhood within a city, which is then neighborhood versus neighborhood within a city, and then how are those relationships different or the same in other cities and across and such. So I think there's a real big opportunity there.
Thanks, I agree totally, Anna, with what you had to say. I mean, I would say, I guess there are a couple of things. One is, we have been, at least at McGill, we've had a project where we've tried hard to actually do this, not across cities, but actually across countries. And I'd say that, in fact, trying to get comparable policy data on like what the treatment is across countries is extraordinarily difficult. And I think doing that across cities is really important, but like the nuances of the policies really matter. So that makes it harder and harder to make a compelling case that it's, you know, as good as an experiment. And so the other thing I really think would be interesting and useful to do is to work with people in the planning, in the city department who are making policies all the time, and to sit down and say, is there a way for us to try and roll this out in a way, not that's, you know, not a natural experiment, but an actual experiment, if that's possible. There are innovations in new study designs and things like that that allow us to do this in ways that are ethical and that preserve randomization, and there's really, even though I love natural experiments, there's no substitute for randomization, so.
One thing I want to add too is, I mean, you know, we're kind of in this digital age in healthcare, and with, you know, meaningful use driving a lot of adoption of electronic health records, and with value-based care really driving consolidation of care delivery. You know, the availability of being able to tap upon clinical data repositories that, you know, capture not only large cities like, you know, New York, Chicago, Boston. You know, conceivably, you'll be able to tap information, you know, across, you know, more less urban, more rural counties, et cetera. So it's definitely something to keep on top of.
So I'll just say one more thing, because we were talking about the speed of doing these studies and the planning. So you can do things very, very quickly. So just two examples. We did an analysis of the media coverage of the Disneyland measles outbreak, and we had the analysis done within a month of the outbreak ending. And another thing was the riots in Baltimore. We were studying that, and we were analyzing, the major riot was on Monday, and by the end of that week, we were analyzing data. So you can do things very, very quickly, which is also an advantage.
Yeah.
So I also had the question about whether big data was, all it was doing was just adding another layer of dimensionality without sort of solving the fundamental causal problem, and I appreciate your thoughts on that. But I was wondering, sort of, maybe things could work in the other direction, and what you might think of this. If we're able to get data sort of instantaneously, very quickly, that's sort of one feature of this, then people can also respond very quickly, and you've just kind of screwed up your design. So I wonder if, yeah, there may be, granted, we shouldn't, you know, always be thinking about, well, where can I get research information from this? But I wonder what you think of that in terms of another implication of the data that's available.
I think that's, to me, one of the more fascinating questions right now of how we can kind of analyze these feedback loops of behavior, policy intervention, evolution of behavior to the policy intervention, and so on and so forth. I mean, that will start to enable us to really ask some critical questions about the behavioral dynamic, the human behavioral dynamics, and then their relationship to policy interventions. And I guess I'll give a really simple example, and one we've been planning but haven't quite gotten to yet. Probably people watching my talk were probably wondering about this calibration measure that we developed, right? This civic response rate. And one of the criticisms of that measure is, well, does it stay the same? right? And now we're updating the civic response rate itself every time we do an update, right? We're using those measures of how many people in a neighborhood are reporting to kind of recalibrate. But the question is, does that relationship, is it a good calibrator as time goes on? Do people start to, I don't know if it's gaming the system, but something about how they're interacting with the 311 system is changing over time, and it's recreating the relationship between calls and objectivity. And so it's something we need to go out and do again, right? We did it the first time in 2011, so game plan is for like 2016 or so, right? Every 5 years, find out, is this stable or does it change? And that's a relatively simple example because it's methodological. But at the same time, do we learn something about how behavior has been shifting in the city? And can we apply that same logic to things that are much more relevant, interventions for public health, right? How do people, engage in behavioral interventions? How do they respond to them, so on and so forth? And I think the continuity of the data allows us to kind of watch that cycle over time, which I think is exciting.
I have time for one more question, maybe two. Over there.
Hi, I'm not an academic. I'm actually a direct service provider. I'm a legal aid attorney here in Philadelphia. So I'm coming at this from a completely different perspective. And what I'm asking about is non-traditional sources of data. I know that our agency collects massive amounts of data in ways that perhaps many academics don't think about. And we've partnered with GIS specialists in the city to do some cool mapping. But my question is, what, from your experience, are some of the non-traditional, perhaps private, perhaps quasi-private sources of data that you could think of that might provide some interesting questions? I'm thinking like utility companies, for utility shutoffs. I know that's a huge issue in this city. But I'd be curious to hear what you guys think.
So I don't have an answer. I think this is really challenging because in my experience, people have data sets and no one knows they have them, and the person who has it doesn't realize it can be used for the purposes that a researcher wants. So this kind of happens all the time. So for example, in the mental health work, we were talking to someone and they told us that there was an art project where someone had collected text messages from people who had tried to commit suicide in the past year as kind of a testament to their will to continue on. I mean, it was motivated just for the artistic value, but I was like, you have messages from people who have tried to commit suicide in a large population. Like, that's incredibly valuable. We'd be really interested in that. So that's a really great example of someone who collects data for a purpose that has nothing to do with anything that we would think about, and they are not advertising the or anything like that, and then we discover it and we have all these other uses. So I don't have a great answer of how you make those connections or how you come up with those, except to tell people that you should look for those interesting data sets because they are out there and you can really do fantastic things with them if you find them.
I have too many answers. Part of my job, so the Boston Area Research Initiative, a lot of what we do is agencies like your own come to us and say, hey, we have this giant database and we don't know what to do with it, right? We know it's valuable to us, but we don't have any analysts on staff. No one who even knows what a t-test is, not to mention knows how to deal with 300,000 records. And so what we try to do is we try to construct collaborations, invite different faculty members and policymakers and practitioners around a table to have a conversation. What do you do now with these data? And we've done this with school choice and lottery data. We're starting to do this with Massachusetts courts. They just have this gigantic database of all of the court records that they've just put together. And I guess the one that's probably the most fun to talk about is a couple of years ago, a group called Arts Boston came to me. And they're a local nonprofit that advocates for the arts. And they said, well, we have an events calendar that we just discovered is an Excel spreadsheet when you download it. And they have these 45,000 records, and they wanted to know, well, what does this tell us about the landscape of arts and culture in the region? And then they mentioned that they have 2 million credit card swipes for purchases of arts data. And so then you start having this conversation, well, you have, not purchases of arts data, purchases of arts and culture, events and tickets and stuff. And then you start to have this conversation, well, what are the analytic approaches that you could do to understand the arts and culture sector then, right? And then how do we help you find the right person to do that with you, so on and so forth. And I think kind of going with what Mark is saying, any data set has that answer. You just have to find the people who, A, are the stakeholders who care about the data and know what they want to learn, and B, the people who are analysts who can take the time to say, well, we could do this in the following way. It's just a matter of starting that conversation.
All right, well, one more, apparently. You got the mic already, so you get it. You snuck it in.
So I don't know if this is, okay, it's working. First of all, thanks for the presentations. They're very nice, very interesting. I'm with the United Nations University, and a lot of what we think about is health in developing world cities. And so the kinds of approaches that you've outlined are great, but they require a certain level of computer savvy, of sophistication, and at the same time they allow for efficiencies. And I wonder if you thought about how they might play in under-resourced developing world cities and how you would go about doing that kind of work.
Looking down, no one wants, okay. So the developing world city, that's a pretty broad spectrum. So there are a lot of efforts in the developing world focused on, for example, mobile technologies, which are pretty widely used. So for example, in some cities in Africa, people don't have internet access or landline phones, but everyone has a cell phone, right? So for example, payment systems in those countries, like banking, is all done via text, right? So there's a lot of efforts, for example, in global mobile health around this. But also just in the data that these places generate, there have been a lot of very creative efforts to extract health data from the records that are available, whether or not they actually have internet access and they're using some type of social network platform, or it's just call records. So for example, there were people who were looking at cell phone call records in Africa around the Ebola outbreak, and using that to identify movement patterns so that we could identify where the Ebola is likely to spread. So, it depends where you say developing and, how much technology they have, but even in areas where they don't have, broadband internet or all these things, there are data sets there and there are a lot of opportunities. Sometimes they're data sets that are hand collected by people in the field and brought back and entered into a database, and I've seen like that, and sometimes it's, the technology people have. So I think that this really is available in a lot of places, and it's just a matter of finding it. I'll give one other example, because I was talking to the UN Foundation, and they're very interested, as you know, in the developing world, and so we were talking about mental health of women in the developing world and using a lot of these technologies to do it, and they're funding research in that area right now. So there are opportunities. Anyone else? Developing world? No? You said get out in New York. This is out in New York.
Well, I want to thank the speakers again, and hope everybody's ready for lunch. Thanks.